This is Dr. Scott MacLean, and this is a YouTube video about implant dentistry. Today's case will be discussing an upper and lower all-on-4 treatment and the subsequent issues that we had with fixing some fractured teeth. So it's a 58-year-old male, has high blood pressure, very heavy bite. In fact, lost his teeth about 8 years ago due to some heavy bite issues. He lost some crown and bridge work. A few lower remaining teeth were extracted, and you can see here after 4 months of healing, the patient returned to do some pickup impressions so we could build the final bars and make the final bridges. This was all mounted on an articulator, so we made the bars, had try-in appointments where we took the bars, did setups and tried everything in. And we thought we were all good, but we had some issues as we went along. So once the final bridge was made, the acrylic hybrid was all fused together. We had one on the upper with 5 implants. So you can see these bridges were built nice and strong and good AP spread, but we still had high forces. And on the lower you can see the AP spread was also quite good. So we got some good aesthetics on the patient, and he was quite happy. Left the office, but within the first hour he fractured one of the lower centrals. So this was on the first time that he tried to bite something and chew something that this came off. So we were worried about this because it fractured actually in the tooth itself. So the bonding didn't let go. It was more that the tooth fractured. We decided at the time that this was a manufacturing issue, so we reset all the teeth, had them reprocessed, and then sent the patient back out. And little did we know, he came back with another lower central fractured off. So we had an issue that we had to look more closely at. But this is actually, the bonding is still holding, it's the tooth that's fracturing. So what we decided to do was to have this patient back in. He comes from about 6 hours away, so we had him back in and remounted his bite. And what you'll notice on the remount is that when we hit down on the canine, he actually has a slide. So he slides over and then hits into the centrals. So this is what we feel is happening when this patient is doing the normal function. They have this hit and slide and then end up hitting the anterior very heavy. So you can see as you hit on the canine, it slides over and the central is picked up. And so once we found this slide and the interferences, then we were able to equilibrate this. So on the remount, the lab re-equilibrated the occlusion, put it back into some group function. So on the the upper canine and premolar, and then the molar. So I wouldn't go back any further than this with group function, and we minimized the cantilever on this case. So we're able to establish some occlusion. This is Dr. Scott MacLean, and this has been a YouTube video about implant dentistry.